Hi, everyone. I am Jay Watson with the Emory Brain Health Center, and I'm joined today by Dr. James Curran. Dr. Curran is a former leading Centers for Disease Control scientist who spent 25 years in the CDC's HIV/AIDS division, rising to the level of Assistant Surgeon General. In 1995, he joined the Rollins School of Public Health as Dean and Professor of Epidemiology, where he continues to serve today. He is also co-director of the Emory Center for AIDS Research. Dr. Curran, welcome. Thank you so much for joining us today.
Thanks, Jay. It's great to be with you.
So we already had questions come in before we began our Facebook Live today, and we'll start with those, and then we'll take as many as we can from people who write their questions on Emory University's Facebook page. We'll begin with this. As a former CDC scientist, you played an historic role in the origin and evolution of the AIDS virus. What did we learn from AIDS that we can apply to this viral pandemic?
Well, I think that, there have been several epidemics of infectious disease in the last few decades. The COVID epidemic, however, is the public health crisis of the century, largely because it affects everyone around the world and it's transmitted through the respiratory route. Virtually everybody is at risk for acquiring COVID. The AIDS epidemic taught us that public health is always political. It reminded us of that. In the best of circumstances during a pandemic, although it needs to be political to involve various groups, it should never be partisan. When partisan considerations come in, there tends to be a distortion of facts and other kinds of interference.
So that leads us to the next question, which begins to tie in a little bit with what you were just saying. You co-signed a recent opinion letter to the Atlanta Journal-Constitution, and in that letter, you and your co-authors wrote, quote, "If we are to win the battle against COVID-19, we need the CDC's scientific independence and unstifled voice," end quote. In that letter, you and other public health experts called on our state and nationwide industry, academic, and government leaders to help the CDC regain its leading position in these times. So as someone who worked at the CDC for years, what are some of the urgent actions you are proposing that they take?
Well, I think we've come to think of the CDC as the place where we can get the truth on the occurrence of a problem. Surveillance, for example, surveillance of COVID, surveillance of breakthroughs that are happening, surveillance of epidemics and hotspots that are occurring. And we expect to hear from the CDC the interpretation of that, rather than just have it on TV reported by Johns Hopkins and letting the pundits describe what it really means. So we expect CDC to be at the forefront of understanding the occurrence of the epidemic and what the variations of it means. I think we also want to have consistent science-based communication. And in the United States, we've had a lot of trouble with clarity and consistency of communication.
So what have they gotten right in your mind, and what could they do better?
Well, I think there were original problems with the test. We underestimated the importance of widespread testing, and there were some initial snafus in getting the test to be made more available. Unfortunately, that led to the first communication snafu. From the very beginning, the two purposes were to save the lives of people who have COVID and to prevent transmission by identifying and isolating people who are infected. Both of these things depend upon testing. But because of the scarcity of testing, messages are coming out that you really don't need to be tested unless you're very sick. Well, that was never true. The truth was you really should be tested. We just don't have enough tests. And of course, now we're saying everybody needs to be tested. But we spent a couple months telling people they didn't need to be tested.
Right.
And we have a similar communication gap with masks. Do you remember the days when we were saying you really don't need to wear a mask?
Right.
Now we're saying you shouldn't go out without wearing a mask. And the scientific facts really don't change. There's always been a need for widespread testing. We just couldn't meet the demand.
Right.
But we should have said, we really know we need it, but we just can't do it. That's a hard thing to do, but it needs to be done.
And that's why a lot of people say that they don't believe that they need masks, because they refer back to the time when we were told that we didn't need masks.
And the president doesn't wear a mask.
Right. A question that has just come in for you, Dr. Curran. Why won't the virus be as contagious in the summer? And should we continue to wear masks forever like they do in Japan?
Well, that's two separate questions.
Yeah.
I think that many respiratory infections have lower points during the warm months than in the winter months. Now, lower amounts is not the same thing as nothing. Influenza, for example, is 40% less likely to occur in New York in the summer than it is in the winter. Most people feel that's partly due to people being outside more often and not having as much close contact inside, although it's not 100% known why that is. It's assumed that perhaps COVID could have the same type of distribution with some relaxation during the hot summer months, but we don't actually know. The other thing is that after a season of influenza, sometimes there's more immunity and more herd immunity, and a large portion of the population has been vaccinated against influenza. While the vaccines aren't perfect, they do slow down the spread somewhat.
What are some elements of state and local public health responses so far that have stood out to you? And what could states and cities be doing to better address the pandemic?
Well, I think first of all, COVID has taken everybody by surprise. We've never had anything like this where it happens so fast. The science has also happened fast. We have sequencing of the virus almost immediately, 100 vaccines that are being proposed or under development, one drug that already appears to be helpful in preventing serious morbidity and mortality, or probably mortality. So that's happened very fast. But the epidemic has caught the society totally by surprise. Immediate shutdown of much of our economy and schools and isolation at home. We know that the social isolation that's occurred has been effective. We can't say exactly how effective, and we can't say exactly how much relaxing it will take us back toward transmission. We also know that a very large portion of the deaths due to COVID are in the very vulnerable elderly. In Georgia, for example, almost half of the deaths are from nursing home and long-term care patients. Mm-hmm. So we know that being cooped up, if you will, with other very, very vulnerable people is a very bad thing. And so there needs to be widespread screening of staff and people in nursing homes and long-term care facilities in order to prevent those deaths. States, I think, have generally taken this quite seriously. The worst epidemic has been in New York, but that's probably been the best example of political leadership, where the governor, along with his public health leaders, have been constantly talking to the public about what to do and what needs to be done.
Another question for you coming in. We need to know what we can do to minimize the spread when others are not considering social distancing or wearing masks, other than us staying home.
Well, I think social distancing yourself works. In other words, you don't have to go to the beach with 12,000 of your best friends 2 feet away from each other. Mm-hmm. I think people can be very sensible about what they do. Being outside is great, but being outside in crowds is not necessarily great. Wearing a mask is important. Protecting the most vulnerable in your families is important. Doing all the things that are sensible, washing your hands for 20 seconds when you come back in.
I have heard that you catch the virus if someone is running a fever. If they are not running a fever, you cannot catch the virus?
Untrue. Much transmission occurs from asymptomatic people to people with symptoms. We can't say for sure exactly how much, but people with no symptoms at all have high titers of the virus in many circumstances. And in some studies, most of the transmission has been from asymptomatic people to others. I think the misconception that you had to be sick in order to transmit came from the bias toward testing only sick people to begin with. As we start to test more asymptomatic people or test large populations such as homeless shelters and jails and poultry plants, we find that many, many, many people are asymptomatic, transmitting to each other.
I believe vital population immunity is prevented by total isolation policies. Doesn't this only prolong the problem?
Well, I think that, the argument that is best exemplified by Sweden, which said, well, we're going to go for population immunity and not close down at all, compared to Denmark and Norway and Finland, was that perhaps if they let it go, they'll get better herd immunity. The problem is that herd immunity is like 60% of the population. And at the very worst part of the United States, in New York, we're talking about 10 or 15% already, with the horrible carnage of the epidemic in New York. Sweden is having second thoughts now because they have 4,500 cases, 4,500 deaths in Sweden, a mortality rate that's higher than the United States per capita, and it's about 10 to 15 times higher than Norway, Finland, and Denmark.
Wow.
So, and the other thing is that maybe by the time we stop social distancing, maybe there will be a vaccine, and then we can use that for herd immunity rather than just let a bunch of people die.
Which leads me into my next question related to the vaccine. Will the vaccine be like polio, where you get it and you're protected? Or will it be more like the flu in that it may not be fully effective and will have to be redone every year?
Well, the one thing it won't be like, I think, is AIDS and HIV, where there still is no vaccine after 30 years. The experience with HIV, though, is to say that the first question is, will there be a vaccine that's safe and effective? Not when will there be a vaccine, which is safe and effective, and how long will it last? The fact that people do recover from COVID, and that recovery corresponds with neutralizing antibodies, makes you think that it is going to be more like a typical virus infection, for example, measles or perhaps polio, than it is like HIV, for which antibody response seems to have no correlation because there's no riddance of the infection. Influenza is constantly changing itself, and the need for a universal influenza vaccine is extremely high priority, but it's eluded us so far. We don't really know whether coronavirus will mutate like influenza. I certainly hope not, that we don't have a different coronavirus that could be transmitted next year. Then the question is, how effective will it be, if it is effective, and how long will it last? And we don't know that either. But I think there's reason to be very hopeful that there will be a safe and effective vaccine that can protect many people for at least a short period of time.
Another vaccine question. Some vaccines are already heading into phase 2 trials and are in manufacturing. If approved, will these early vaccines be able to be mass distributed within the next 6 months?
Take away the next 6 months, and I'd like to applaud the U.S. government for taking the risk by ordering vaccines which have not yet shown to be safe and effective. In other words, the idea is we will buy $1 billion worth of your vaccine in case it's safe and effective, and then we will have those doses of vaccine. There are about 100 vaccines that are being proposed and studied. Some of them are in Great Britain, in Oxford. Some are in China. We're not going to be able to buy all of them ahead of time. There may be more than one that's safe and effective, or there may not be. So we're taking some bets about which ones we should buy ahead of time so we have a lot in case they work. But it's not like we're buying vaccines now that we know work. We're just buying ones we think might be ready. I don't think it's going to be 6 months. I think it'll be longer than that. But I'm optimistic that there will be this. And I think there'll be a huge commitment toward production and purchasing of vaccines for the United States. There's going to be a lot of competition for the world to get this. Much of the developing world won't be able to afford it. So if you don't vaccinate the world, you could end up with more epidemics coming. But I think there'll be a huge commitment if there's a safe and effective vaccine to getting it done. And I think we can convince the American public to take it. That's not easy. We're not so good at taking flu vaccine every year. Mm-hmm. And a lot of us a lot of people in the United States don't trust the government.
That's true. This next question is one that could have come from many, many people, because we hear this quite a bit these days, the decision about reopening the economy versus not. So this question is, stopping the world while we try and find a cure no longer seems reasonable. How can we as a country move forward without a cure? It seems that a lot more damage has come from staying inside, unemployment, mental health struggles, loss of social networks, etc., than the damage from the virus.
Well, I think that there's going to be a natural balance between public health concerns and economic concerns. And that's why we can't have partisan politics involved. We have to make sure that all of the facts are on the table, and then people, not just in public health or not just in business or not just in politics, can make the decisions. What we're seeing now is the country is tiring of total social isolation and social distancing. Some of the politicians are being very bold by saying, I'll be the first one to say we can open up. But virtually all the states are opening up some, and businesses are struggling to open in a new way. Many restaurants are opening with social distancing. People are very aware of wearing masks. And so I think that type of reopening to allow the economy to get back a little bit and also to allow people to live a normal life is good. Mm-hmm. We have to be cautious about just, I don't care anyway, what the hell kind of reopening. You know, I mentioned before the real vulnerability of nursing home patients. If we could solve the nursing home epidemic, we could probably reduce deaths in the United States by 40%. Reopening may cause an epidemic of young people who aren't going to show up in the hospitals as soon, and we could have a big explosion of new cases without having as many deaths. And so people will say, hey, we're doing pretty well when we've solved the nursing home problem. But what we're doing instead is making this into a much, much bigger problem, which will eventually come back and affect all of us. There has to be a certain amount of charity involved. When you're interviewing young people on the beach and they'll say, I'm not so worried, I'm going to get it anyway, just hope they don't give it to their grandfather when they go home.
Exactly. We have a lot of questions, today asking, do I send my child to daycare? Are schools going to be back open physically in person in the fall? What are your thoughts on putting our children in crowd situations, which any school would be? Is that going to be feasible this fall?
I think it's going to happen this fall. And it comes from the same place of reopening the economy. Virtually all families now, both people work. There are now more women in the workplace than there are men. There's no one to stay home to take care of the kids. And also they need to further their education. It looks like children, of course, suffer fewer long-term serious consequences of COVID, but they do suffer them. They do have some serious conditions. They're probably much more likely to be asymptomatically infected and perhaps asymptomatic transmitters, but what evidence there is suggests that they're less likely to do that than adults. I don't think we know the answer completely to that, but I think schools that do reopen need to have screening available. They need to make sure that their teachers and staff and other people are not infected. They need to protect the vulnerable staff and teachers that work there. And they need to socially distance as much as they can.
After someone is recovered, can they still be a carrier if they come into contact with another person with it?
So one of the questions is, does antibody and recovery of infection confer immunity? The assumption is that it does. There have been several cases of infection where people have had a positive PCR test several weeks after their illness. It's not known whether they're really infected with live virus or it's simply just a retained positive test. That's something that's still worrisome, that we have to understand the duration of infection and whether or not people can become reinfected. If they become reinfected, it's not only for themselves that we worry, but also for the whole concept of vaccines, which depends upon the antibody response, which we're hoping are protective to people. We should learn a lot more about that in the next few months. But for now, a positive antibody test is not a back to work, I can't get it tool.
Okay. If you had to name a few next steps this country should take to end this pandemic, what would they be?
I would have the president and all his advisors say that it's patriotic to be tested and to isolate and be quarantined if you're close to a case, to have all your close contacts tested and be isolated. It's patriotic to wear masks. You can even wear MAGA masks for all I care. But wear a mask. I'd rather you didn't wear a MAGA mask, but you could do that. But I think we need to have a call toward patriotism to end the epidemic. We need better communication. We need to continue the science. We need to continue social isolation within the context of opening up. And we need to really, really push testing a lot more.
How do you think the history books will remember the COVID-19 pandemic? And what impact will it have on the future of public health in America?
The 2020 COVID-19 pandemic is the public health crisis of the century. And I'm talking about this century going forward. People looking forward to this will think of this the way my father spoke of World War II. He served in World War II toward the end, and he would often talk about how the country changed after World War II. I think this is the pandemic which will change the world. And we will look back on it and say, I remember how things used to be before the COVID pandemic.
Like before 9/11, a very minor thing, but the changes, how it is different to go through the airport post 9/11. You think we'll see changes like that will just become part of our lives?
This is much bigger than 9/11. First of all, this is worldwide, not just U.S., and it's something which affects everybody in every country. And everything we want to do, whether we want to meet new people, whether we want to go out to dinner, whether we want to travel to visit our relatives, whether we want to travel on vacation, what we have for marriage plans. My son's marriage was canceled. What do we do for retirement? How would you like to retire and stay at home for the next 5 years? So I think that people will just change, and this pandemic will change the way we think of public health and the way we think of our society.
For right now, though, shouldn't we stay home if we can? Is it, I know it's okay to go outside, but I'm talking about socializing with other people and transmission of this virus. Is staying home, if possible, still the safest thing to do?
Well, I think staying home is the safest thing to do. And when you're not home, to socially distance when you're out.
Mm-hmm. One thing we talked about right before we went live with our Facebook was I've had many people reach out to me and also people posting on social media saying that COVID is no longer a story because of the protests happening around the country. And I found it interesting, your response to that. Can you talk about that?
Well, I think that, first of all, the homicide that occurred in Minneapolis is not just unforgivable, but it's also too much the way things have been. We had a similar killing in Georgia, Brunswick, Georgia, just a few weeks ago. And there are several killings before that result from police violence, which is an example of what it's like to be black in America. Mm-hmm. What a risk it is just to be black in America, not with COVID. The COVID pandemic itself, once again, underscores our disparities. We shouldn't be surprised, although we shouldn't like it and accept it, that blacks are more likely to die from COVID than whites, that neighborhoods where poor people live are more likely to be places of transmission, that people who are homeless in jail or prison are more likely to be underrepresented minorities and more likely to get COVID, that the poorest nursing homes have the highest rates of COVID. We shouldn't be surprised at these things. Then we shouldn't be surprised when people are out of work. The ones who can't get unemployment are also more likely to be underrepresented minorities, or the ones that have to go to work to stock our grocery shelves and to do the things like janitorial services, who are considered essential workers, but the lowest paid essential workers are also more likely to be underrepresented minorities. So you throw in another senseless killing to people who themselves have disproportionately suffered from COVID, and it's not surprising that the match is lit.
Another question that has come in for us, Dr. Curran. We hear social distancing, but the interpretation varies from 6 feet to 27 feet. What is really safe for indoors, and if someone is sneezing? That seems to be the extreme ends of the continuum of risk.
Well, people shouldn't sneeze in front of other people. People who are ill should get tested immediately and quarantine themselves till they get the results back. Don't go any place with people who are sick. If you're sick, don't let anybody else get near you, at least until you've been tested. Don't sneeze in public. Wear a mask every place you go. I think 6 feet is still the right amount of time. Now, if you can create scenarios in an actively air-conditioned restaurant that is blowing from right to left, that if you're 10 feet left, you're going to get it. But that's not the same thing as the general rule of 6 feet.
Right. Another question, for office places and schools that are preparing to reopen, what resources should they consult for guidance on how to do so safely?
Well, I think that the CDC guidelines in reopening are pretty consistent, pretty helpful. They call for cleaning of facilities, cleaning of rooms, how to clean these rooms, masks, social distancing guidelines, and things like this. And they're made actually quite specific even for certain types of places like schools and places of worship, poultry plants, nursing homes, but they're pretty consistent with each other. Some of them call for more testing than others, but I think they're all pretty consistent. And they involve not only having employees stay home when they're sick, but having them be compensated for staying home when they're sick. Mm-hmm. It's a terrible disincentive if you tell somebody they have to stay home, but then you don't pay them. I mean, you can't expect them to stay home and not feed themselves or their family.
Do you think if there are outbreaks at schools or universities, they will shut down again?
Well, one thing I can say about COVID is that 100 people will try to predict the future, and they'll all be wrong. People will tell you what's going to happen, and I get asked a couple times a day what's going to happen, and I always say I don't know for sure. I'm certain if things got a lot worse, we would take more drastic measures. And I'm worried that if we loosen up too much, they're going to get worse. But I don't know if it's going to be a lot worse or how we'll react to it.
How will the introduction of a vaccine change the current scenario?
Well, if we have a safe and effective vaccine, and we're sure that it's going to last at least a couple of years or more, there will be monstrous campaigns supported by the government to vaccinate as many people as quickly as possible in the United States and to make vaccines available. Everyone will be promoting this vaccine. It's got to be safe and effective. And if it's safe and effective, every politician, every sports star, every movie star will be promoting the vaccine every day. And it will be the most remarkable thing you've ever seen. There'll still be people who won't get it. We want to make sure that it's free. We want to make sure people who don't have insurance can get it. We want to make sure that people can get it from somebody they trust. But I think there'll be a massive campaign, much like the polio campaigns were.
I'm going to read you a cluster of questions all tied to the same topic, and then you can just talk about it overall. If a test comes back positive, since there's a 3 to 7 day delay in getting the results, how many days should a person count back to notify people you've been in contact with? Other question, can you explain how contact tracing works and how it is a vital means of helping us control COVID-19? So someone talking about how they notify people they've been in contact with, but contact tracing, how is that going as far as we know, even here in Georgia?
Well, it's just starting. Contact tracing is, for the most part, just starting with the release of hundreds of $millions of federal funds to state and local health departments for testing and contact tracing. First of all, you shouldn't wait 3 to 7 days for a test result. The test results should be available in 24 hours. And so we have to do better with that. If someone is tested and they're positive, they should go back 3 to 4 days before the onset of their symptoms if they're symptomatic. Or if they're not symptomatic, at least 3 to 4 days before their test was taken. The most important contacts to notify immediately are the household contacts. They're the most likely ones to be infected. Most people would like to notify their own household contacts. And what they should do is they should immediately get all their household contacts tested. And then if they have no symptoms, they should just be quarantined for 14 days, along with the isolation of the infected person. And the infected person should be isolated separate from their household contacts. If any of them are positive, then the whole thing starts over again. Contact tracing is a very personal thing to do. It involves trust. And of course, many people can do their own. If a person is infected, say you are infected, who best to notify your husband and children but you? Who cares the most? And so that the contact tracer at the health department can say, who are your close contacts? And you say, I'll take care of my family, but where can I get them tested immediately? And in the state and the county should be able to help with that. Now, contacts outside of that are people who've spent at least 15 minutes close to the infected person within 3 days before the onset of their symptoms or 3 days before their test, and they've been very close to them. That doesn't mean that you're trying to track down everybody in Piedmont Park. I mean, you have to prioritize. But the priorities are the household contacts and other very close contacts at work or in a social environment.
Is a face shield safer for the person wearing it than a face mask? You know, there have been discussions about this. Dr. Joseph Fair, an epidemiologist who contracted COVID, believed he may have gotten it on the plane, although he was wearing, an N95 mask. He thought he may have gotten it through his eyes. What do you say to a face shield versus a mask?
Well, an N95 mask is better than the kind of mask I have, or the small paper mask. N95 mask has to be fitted correctly, and that's sometimes a problem. There's a reason that people who are putting people on ventilators have face shields and more protective equipment, but of course they're directly exposed to the respiratory tract. I mean, they are entering dangerous areas. So I think that, obviously if you dress like somebody who's putting a patient on a ventilator, you're probably going to be safer than if you don't. But that's not really practical or comfortable for walking down the street or jogging.
Yeah, true. What do you think is the most important thing we have learned thus far in this pandemic that you think we will carry forward and build on in the future? And what is the biggest improvement that we need to make?
Well, I think we've learned that a coronavirus, the previous coronaviruses either caused a common cold or were very serious but couldn't be transmitted readily. Now we have one that's quite serious and can be transmitted readily, and it's new to populations. So we have seen one of our worst nightmares, a very easily transmitted respiratory virus around the world, which can kill people rather readily. And we've learned that an all society response is really important in this regard. And we've learned the strengths of our own society and our own culture. We've learned that we have the best hospitals in the world with the best intensive care units and can provide the best care to the very sickest coronavirus patients. We have a much better survival rate than many countries do among people who are very, very sick. We also learned that we have a neglected public health system, and our federal system doesn't allow itself to be managed at a national level very readily. And it takes skill and leadership to provide that kind of management. It's very difficult to contain a virus which doesn't know state lines or county lines by simply saying, we'll let all the states and counties do what they want to. But in fact, that's our federalist society. We let states decide whether they expand Medicaid. We let states decide how many uninsured people they can have. We let states decide whether they want to fund their public health system compared to school, Medicaid and education. We let the breakup between public health and healthcare be so far apart that most people in healthcare don't even know who the state health commissioner in their state is. So we've allowed that kind of erosion of public health throughout the United States, and now we're expecting it to respond in a uniform way with less than uniform leadership. I'm not sure that's what you wanted to hear, but
no, I want to hear all of it. I've appreciated every bit of this conversation. I would like to wrap up our time with you by asking you a final question. It's not an easy one, but
none of them are easy.
I would love for you to treat our audience and me like a dear friend who says, probably doesn't call you Dr. Curran, may call you Jim. How do we get from now until a time where we have a vaccine? You know, as you who cares deeply about us, what do we do or not do? How do we stay okay? How do we deal with all of the disagreement? Like, what would be your best advice for the people that you care about dearly for kind of a little roadmap for how they get from this point to the point where we may be getting our vaccine?
Well, I think you can, you're asking what does an individual do now? Mm-hmm. What does your best friend individual do?
Yes.
And I think that's a helpful thing, because the thing is, a lot of times when we come to personal risk, we want to blame society. You know, if our president just acted different, if our health commissioner acted different, if the CDC just acted different. Well, the thing is, what you are dealing with is uncertainty in the future. And even the very best leadership can't tell you what the certainty is going to be. Mm-hmm. So what I would do is I would stay up to date in what's going on, what there is to learn. I would also be honest about the vulnerability that you have and your family has. In other words, are you at increased risk? But don't think of yourself that way. I mean, none of us do. I'm a healthy old man. I run and do all sorts of things. I don't think of myself as elderly, but I fit the category. Some people have rheumatoid arthritis, and they don't think that that's a risk, but they're taking immunosuppressant drugs that they've seen advertised on TV. People who are obese are at risk, and they don't think of themselves as obese even, but they're at risk. And so diabetes, there's all types of things that can increase your risk. Or your husband or wife has one of those conditions, or your child has severe asthma, or your mother or father live with you. And then the vulnerability of your household is greater, and therefore your responsibility is greater to protect yourself, not just that. In terms of protecting yourself, I think the best thing to do is to avoid crowded situations. Always wear a mask when you're outside. You know, a mask protects in a number of different ways. It protects you from coughing or sneezing on someone else or breathing on someone else. It has some protection from you, probably, for other people, but it also is a message. When you're walking in the park and you see people with a mask on, I always do this when I'm wearing my mask and I see people who don't have a mask on. I kind of look at them and smile, smile through my mask, because it reminds them of the risk. It reminds people that we're not in a risk-free world. And when I do that, they walk further away from me. I don't know if they think I have it, but whatever they think, it reminds them of the risk. And so I think that the more you can do to be collective and also be individual and then stay on top of the facts, don't believe just the things you want to believe, but, carefully curate your facts. Don't just because somebody says something works, test that out to find out through other resources. And but you also have to go back to work and enjoy life.
But that's hard. I mean, a lot of people are talking about the psychological fatigue of this, because enjoying life for a lot of people involved travel, getting on airplanes, getting together with groups of friends, going to favorite restaurants. And so they're trying to supplant that, and they don't feel like there's a lot of options.
Well, my wife and I, our children are grown up, and we don't have to cook at home every day. So we probably eat out 5 or 6 days a week. Sometimes these are inexpensive places, but they're our favorite, Mexican, Chinese, Japanese, sushi, occasional fancy place, Italian. And now we can't do any of those. And so you get pretty bored eating the same stuff all the time.
Yeah.
But you can change that up. There are some restaurants opening up now with outdoor tables that are 10 feet apart. You can find places that you think are pretty safe, that are not crowded, as opposed to ones that are. And I think that's probably okay. But you can't, the days of going to the sports bar and yelling for your favorite football team are going to be over for a while.
Yeah. Dr. Curran, thank you. I really appreciate your insight and advice and guidance on all of this and answering all of these questions as they came in. It has been great to talk to you, and I hope we can do it again.
Sure, Jay, anytime.
I appreciate it, sir. Take care. All
Okay.
right. Bye-bye.
Bye.
Everyone, be well. We'll see you soon.
Yes, both of us.
Both of us. We'll see you soon. Bye, Dr.
All right,
Curran.
bye.